Hi, everybody. I'm Michael Munson with Forge, and I'm happy that you're here to join us tonight. We might be a little bit lopsided from the team end to the participant end, but hopefully this will give you a good overview of what our project is and how you can get involved. So you are in the right place if you're trying to be at the understanding cancer disparities in the trans and non-binary population. So we're going to share with you a little bit about the project and how you can get involved. So our agenda is really simple. We're going to do a little bit of welcome and let you know who is on the team from both Forge and the Medical College and the Cancer Center. We'll look at what the project is, so give you an overview of what the totality is. We'll look at some of the team responsibilities and then how you can apply and what that process looks like. And we'll have plenty of time for questions. So most of us are really, really familiar with Zoom by now after we've been through the pandemic years for so much, but you should be able to see a chat and a Q&A, so you can ask questions or interact with each other in either of those formats. The Q&A will have an anonymous option, so if you'd like to ask a question and not disclose who you are, you can feel free to do it in the Q&A. Just a couple of other tidbits. You can change your view if you'd like to look at things differently than how you see them right now. And Caleb, if you can initiate the captions, which are auto captioned, not perfect, but it will help for folks that like to have that text scrolling along the screen as well. So we wanted to just do some quick intros about who we are as a team and let you put a face to different names. I'm happy to get us rolling. So if we can all, those of us who are on our team can share your name, your pronouns, the organization that you're from, what your role is in the project, and why you're involved. So again, I'm Michael Munson. I use he, him, or they, them pronouns, and I'm with Forge, which is a trans organization headquartered in Milwaukee, but doing nationally scoped work, mostly on anti-violence. My role in this project is technically as co-lead. So we have a co-lead on the community side and a co-lead on the medical college side. And why I'm involved in this is that we were asked, and it's a great project. And we love to look at disparities within our population and how it relates to mental health as well as physical health. So that's a little bit about why I'm involved. Chandler, do you want to go next?
Yeah, so I'm Chandler Cortina. My pronouns are he, him, his. I'm a breast cancer surgeon at the Medical College of Wisconsin. I'm our academic co-leader for this project. And my research is really around cancer disparities in gender and sexual minority populations. As a gay man, I think it's a really important aspect of cancer care that's not really studied. And so that's how I've got involved in this project.
Great, thanks. Toby, do you want to go next?
Absolutely, thank you. I'm Toby Kothra. My pronouns are she and her. I am with the Medical College of Wisconsin, and I'm a program manager in an initiative known as the Community and Cancer Science Network. And you'll hear more about that today and then moving forward. And I serve as a facilitator and someone who works with transdisciplinary or multidisciplinary collaborations, and that's my role in this work. And why this work is important to me is cancer disparities or disparities in general have always been a passion of mine, and because I've always found that in a first world country, any sorts of disparities or health disparities that we have are particularly appalling. And so I've really been driven in my professional life to work to find ways to address that. So thank you.
Cool, great, thank you. Melinda, would you like to introduce yourself?
Thanks. Thank you, Michael. I'm Melinda Stolle. I am a professor at the Medical College of Wisconsin, a clinical psychologist by training. And like Toby, I'm engaged in this work through my role as the academic lead of the Community and Cancer Science Network. And I'm particularly thrilled, I would say, about the fact that we received funding for this and that we're engaging in this work addressing disparities, because I think there are a few opportunities to bring community and those in academic medicine together to really understand perspectives that together can address some of the barriers to healthcare that we see. And so I'm really excited about being with this group. Thank you.
Thank you. And I am not seeing Andy Petrol logged in yet, but Andy Petrol is one of the other team members. He's an infectious disease doc, and many people might know that he is the kind of the medical director, the head, the brain source of the Inclusion Health Clinic. So he's an active part of this team as well. Laura, you are up next.
Good evening, everyone. I'm Laura Pincenalt. I'm an independent evaluator. I work with the Community Cancer Science Network. Our focus on evaluation at Evaluation Plus is really on projects that promote change and elevate equity and voice in that process. And we have projects both nationally and internationally focused on advancing LGBT plus human rights and advocacy around the globe.
Cool, great, thank you. And then Caleb.
Hi, my name is Caleb Weinhardt. I use he, him pronouns. I'm one of Forge's project coordinators. I'm involved in the project because Michael invited me to be, and I'm also really excited to be working toward addressing some of the health disparities in the trans community.
Excellent, thank you. So now folks have some idea of at least who we are as part of this really excited to work on these issues team. Melinda, I'm going to let folks go and I'll just advance the slides as we move along.
Okay, great. Thank you, Michael. So as I mentioned before, the Community Cancer Science Network, and what that network is hoping to do across the state and across many different cancer-related problems is to bring community partners and academic partners together within these. And if you can go to the next slide, please, Michael. Within what we're calling these transdisciplinary teams that bring people from different parts of research, so physicians, people who work in the lab, people who are public health researchers, and also community members from different sectors within the community to build what we call a transdisciplinary team to share their perspectives and engage in this process of co-learning from each other to get a whole broad and deep understanding of why cancer disparities are occurring in the trans and non-binary community, and then also what can be done to address those, but also prevent any further disparities in the future. So that team will come together, come up with a social action and research and healthcare agenda, which will then be disseminated and eventually bringing groups back together again to be able to implement those. And all of this work is done within a context of grounding principles of deep equity so that all voices and perspectives have equal value. Biology to policy, we are not going to address cancer disparities if we don't understand everything from biology and genetics all the way up to how social and healthcare policies impact that. And then systems thinking, that we need to think about changing patterns in our systems. It may start at the individual level, but the idea is that eventually we will be able to change systems to, again, address and prevent cancer disparities. Next slide.
So the general kind of stepwise overview of what we plan to do as a team here is that the first step is really going to be to apply, where they're going to interview interested parties to see, who is interested and why people are interested, and to get a little bit, for you to know a little bit more about us and for us to get to know a little bit more about you. Our next step is going to be team selection. So we'll form our final team, both of kind of community members and academic members. We're then going to be meeting about twice a month, which we'll talk about in a little bit more detail. And then, for participating in this, our community members, so you guys will be getting paid to help cover your time for participating in this. And ultimately, the goal is for the entire team to really be a part of a project that directly helps the entire Milwaukee community. We can go to the next slide. And so who should apply for this? So we're really looking for trans and non-binary community members. And it's really important that that everyone on the team is really interested in being working on this project collaboratively, which I apparently can't say this evening. And also have an interest in understanding cancer disparities and really improving health outcomes for trans and non-binary people here in Milwaukee, but also across the country. And we're in particular going to be selecting 4 people to be a part of this group from the community side. Is this still me?
No, that's no, it's sorry. So for the team members, we're asking people to participate, here's my word I can't say, in meetings probably about 2 times a month, maybe 60 to 90 minutes. And that time frame will be determined by everyone that's on the team. We want people to attend and to engage and to actively listen and question all of our own assumptions. It's important for people to be willing to share their expertise and experience and learn from everyone else on that team. We want people to share their personal and professional expertise. I want to mention that too, and how that relates to cancer disparities, and other existing efforts in the community. There'll be activities, so we want people to engage in those facilitated activities that promote sharing and collaboration. And to openly, there's a lot of sharing. We want to share thoughts and ideas about cancer and the impact on the transgender and non-binary population. We'll use that information to refine our understanding, and we'll then look to everyone to help design any necessary data collection activities like focus groups or discussion sessions, and identify potential participants and location for those discussions. Our team will be asked to assist in preparing findings from those discussion sessions, particularly to help clarify jargon or any concepts that might be unclear to others. We'd like people to provide feedback within appropriate timelines, and that to use data and the discussion session findings to inform prioritization for the implementation plan, that final plan, and that will include potential community-based implementation or research agenda questions. Next slide, please. And so we're looking for people who have ample time to devote to this project, who have a personal or professional experience with cancer, health disparities, particularly for the transgender and non-binary population, and then also experience or expertise with social determinants of health, that they're eager to really help improve the health of Wisconsin, and that they are curious about understanding more about transgender, non-binary cancer health disparities, and curious about developing those solutions. We want to move beyond traditional community gauge participatory research and really find different approaches. We want people who are interested in connecting this work to a network of potential partners, and that they're able to listen to multiple perspectives, and that they're open to having their understanding influenced by others. And so next slide, please. So we'd like to begin this in June of this year, and our meetings would continue through November 2024. And again, as mentioned earlier, that would be about 2 meetings a month, 60 to 90 minutes per meeting. There might be time outside of meetings where we might ask people to read an article or maybe watch something, consider, reflect, those sorts of things. And that might be maybe 20 minutes to an hour each month. Next slide, please. As Chandler had mentioned, for our community-based team members, we're offering $75 an hour for your expertise on this initiative. We would be collecting some information from you in order to pay that out, including a social security number, and then how to apply. On our next slide, it is a short survey that we would like you to tell us that you are interested. There is the link. You can also use that QR code, and I think we're going to put that link in the chat. I'm going to try to capture that right now, and we'll get that right in there. So if you bear with me while I copy this and add it to the chat. Oh, Michael beat me to it. So that is right there. And we're asking people to apply before April 17th. Next slide, please. And so what will happen after people apply? We will follow up with everyone, and we will be selecting candidates to be interviewed. It's going to be, around a 30-minute get to know you call. And those will be scheduled in between April 17th and May 1st. And then we'll have the final notification on May 15th. At the same time, we're working with our community members. We're also having those conversations with research or academic medicine researchers from basic science through population health. And we're also talking to others in the community, clinicians or other healthcare providers that could be involved. So this is helping simultaneously. So we're building that whole team at this time. So if there's questions also, please feel free to reach out to me, and my email address is there, or to Michael at Forge.
Thank you, Toby. You're just always so nice and explanatory and framing things so well. So we wanted to make sure that there was plenty of time for folks to ask questions. I know this was kind of a quick overview, and it may not give people a full enough vision of what the project is or how you can be involved or how you can express more interest. So we are definitely open to more questions. If people want to pose something or make a comment. I know somebody made a comment in the chat already, which is really great. It's always great to hear what people are doing and what their interests are. And Toby, one of the things that, as we wait for people to kind of ask some questions, you use this really long phrase of like community engaged participatory research, and how this wasn't going to be that. I'm like, whoa, those are like big words. So but I think you described what it is versus what that isn't. But did you want to say anything more about that design, about how this is going to be more egalitarian? And
Sure, I think that's a great question. Thanks, Michael. And and I think you just also brought up something that one of the things we really want to do is create a shared vocabulary for everyone that's involved in this process, so that when maybe someone says community engaged participatory research, that then we all know what that means. And so there's certainly other phrases or words or things that we don't know, that we just need to build our personal vocabulary on. So that's a great question. So really what happens a lot of times, or with a lot of work, and maybe Melinda or Chandler can even add on this, is it's a very traditional approach of working with community. And a lot of times it tends to be maybe community focused or work that happens in the community that's focused on making changes in the community. And what we really want to do, what's a little bit different with this initiative, is build an understanding, not just focused on what changes need to be made at the community level, but maybe that there's work that needs to be done across that spectrum, ranging even from basic science or molecular research, maybe in clinical care or clinical research. And then if there's on that population side, or even social action work that could happen. So it really extends across that spectrum.
Thank you. And you also mentioned social determinants of health, or maybe Melinda did. And just, I mean, Melinda, if you want to share more about that, it's just, I think that that's something that it's jargon for some people, and it's really obvious. I
Yeah.
mean, the concept is really
Yeah.
practical. So
Yes, I agree with you. And it's become quite the trigger word in many ways, everything you hear. So social determinants of health are things that many of us know of, and it's been collected in the social determinants of health. So when you think about education, healthcare access, income, race, ethnicity, where you live, those things will all determine ultimately how your health is in interaction with your personal genetics, your upbringing, your relationships, your interactions. And what has been discovered over, I mean, for most of it's like, duh, is that social determinants of health oftentimes drive health. And that's what these work groups would really hope to do, is understand how social determinants of health drive health, but also interact with other parts of people's lives.
thank you. And I know just, some of us who they just come off of our tongue of, social
Yeah,
determinants
it's so
of health,
true.
all
So
these things.
can I just share real quick? It's interesting, Michael, because we've had a group like this. And one word that came up, it's going to sound kind of silly, is the word model. And we realize that for scientists who work in the lab, model meant one thing. For doctors, model meant another. Like a model in the lab was how mice, like how they do their experiments with mice. In the healthcare clinic, it was, how work was performed. And then for a behaviorist like me, a clinical psychologist, it was, how do you explain how people change their behavior? And then for community, model had many different connotations, right? Someone who models, a role model. And we had a pretty robust conversation about this, where everybody felt comfortable saying, hold on, I don't understand what you're saying when you say model. And we had this very robust discussion around, oh my gosh, everybody in this room thinks of this word differently. And that's what we hope to accomplish in these groups as well, is sort of break down those barriers to understand others' vocabularies and experiences, and come to this shared understanding.
That's a great example. That's a really great example. And a great example too of like how, like you were saying, like everybody talked about what it meant to them, and that listening process, that sharing process is really the heart, I think, of what we've talked about. This is about, is like that sharing between each other and understanding better. And then how do we play off of each other, and where do
Right.
we get to when we really listen deeply to each other in this process?
And Michael, one thing I want to add for all of us to understand is that conversation didn't happen like in week 2 of meeting together, right? This process is very much, let's take the time, let's get to know each other, let's create a space where we feel safe. And because, you think the academics showing up feeling safe, everyone's worried about saying something wrong or misunderstanding something. And this, what we hope to do and what we have accomplished in other settings, is creating a space for people to settle in, develop relationships, and be able to feel comfortable admitting, right? Like, gosh, what are you talking about? So, yeah.
And that is so atypical of our world, where it's fast, fast, or the 8-minute doctor's appointment, or whatever it is. It's so that's really refreshing. And so I bet that it's really uncomfortable for some people to get to that place of like, oh, we're going to take our time, we're going to get to know each other, we're going to build trust. But there's some really, really amazing beauty in that process.
It's also really fun at times.
That's
We have fun too.
So for the people listening, can we promise that there's going to be laughter at every meeting? We could probably promise.
Maybe
that.
not every meeting, but most meetings.
Most. Yeah, exactly. I'm not seeing any questions from folks. Chandler or Laura or Toby or Caleb, do you have anything that you want to add to what we've talked about for people to know?
I was just going to say, I think this is a really great and unique opportunity for, for the Milwaukee community to come together in a really unique way, to help try and identify how can we reduce cancer disparities for trans and non-binary folks. And I think, this opportunity is really unique, and I'm really excited to see the great work that's going to come out of this over the next couple of years. And I really appreciate everybody that's here tonight, both as panelists and that joined, that signed up for this. Time is really valuable, and so I really appreciate that you guys could all be here tonight.
Thank you. It's good. Toby, Laura, Caleb. I take silence as a nope, not going to say anymore. We've said a lot. So Caleb, if you could drop in again in the chat for people to share, to save if they'd like, Toby's email address, my email address, and how to apply. And we will also post that when we post it online for people who are watching this later, so that you can reach out to us and find out where to take the next steps. So we are really excited to see where this goes and meet new people and have a really great, wonderful, collaborative work team that hopefully will be solidified by mid-May and will start in June. So thank you, everybody, for spending part of your evening with us. And hopefully we won't get bogged down by the political news of the day. But please enjoy the rest of your evening, and we hope to hear from a lot of you soon. Thanks, everybody.
Thank you.
Bye, good night, guys.
Good night.
Good night, everybody. Thank you.
Good night.